In our top stories tonight, Barbados records its 5th COVID-19 death. An initiative to recognize frontline workers in the COVID-19 fight. Government considering penalties for people who burn garbage indiscriminately. And in sports, the Carifta Track and Field Championships officially cancelled, but swimming is still keeping hope alive.
Newsnight Headlines was brought to you compliments Omega XL.
Broadcasting from our studios in the Pine St. Michael, this is CBC Newsnight, starting now.
Very good evening, I'm Lisa Broom, and we start with the sad news tonight of another death from the coronavirus. The 52-year-old Barbadian man who passed away this morning became the 5th person to die from COVID-19 to date. Since April 4th, 4 men and 1 woman have succumbed to the viral illness. The number of COVID-19 positive cases in Barbados now stands at 73, with 1 new case reported today out of 22 tests yesterday. The latest patient is a 48-year-old man who came into contact with a known case. The number of people who have recovered rose to 15 after 2 more people left isolation today after receiving 2 negative test results. 53 people remain in isolation, and joining us now to talk about these latest figures are COVID-19 czar Richard Carter and Acting Chief Medical Officer Dr. Anton Best. Good night, gentlemen. Thanks for joining us.
Good night.
Now, let me start by asking you, Dr. Best, what more can you tell us about the gentleman who passed away, whether he had comorbidities or anything of that nature?
Thanks a lot, Lisa. I'm sorry that I had to begin on a somber note and to mention the 52-year-old chap who is no longer with us. He was diagnosed just over 2 weeks ago and has been in isolation since. He spent his last few days being ventilated at the isolation facility at Enmore. I would also like to mention that he did have comorbidities. So we do mention age being a risk factor and the presence of comorbidities. And in this particular case, this guy did have diabetes. I would like to take the opportunity on behalf of the Ministry of Health and Wellness and the wider government of Barbados. I offer sincere condolences to his family and to his relatives.
We would like to join in that as well. About the people who are recovering, how are they progressing? And we're also curious to know how the 7-year-old boy is doing.
Sure. So we've had 15 recoveries in total. 2 additional recoveries would have happened yesterday with their second test being negative, both of them. The vast majority of cases are mild to moderate, with very few being severe or critical state. You asked about the 7-year-old child that we have in isolation as well, and that 7-year-old is doing extremely well, has been from the start and continues to do so.
All right. Now tomorrow, Mr. Carter, tomorrow we are opening up for shopping, opening up for banking by last name. What plans are in place to police that process tomorrow to make sure that all goes according to how it's supposed to?
Thanks for the question. We have had to balance the obvious socioeconomic need for access to money and food against the public health need for physical distancing in order to try to make sure that we stay ahead of the epidemic. So we have instituted a system to allow persons to be able to access shops and banks and hardware stores, basically using their surname, the first letter of their surname, and the schedule has been printed and made accessible, made generally speaking, to the population of Barbados for this purpose. In terms of managing it, the persons will be required to travel with a form of photo identification, which they will present at the business place, whether it is the supermarket or the bank or the hardware store. And that photo ID will be used to legitimize the fact that that person is within the surname grouping that is eligible for shopping on that particular day. I want to say also that a specific day has been, or 2 specific days have been set aside for the elderly and persons with disabilities. And we are asking persons who are elderly or persons with disabilities to stick to those 2 days which have been identified. basically because we want to ensure that we maintain as much protection of this particular group, elderly persons 70 years and over, as is possible.
Now, I have a couple of questions coming out of that for you, Mr. Carter. On the last point, you mentioned elderly people 70 years and over. We've had people asking how come it is 70 and not 65 or 60 as well, especially people who have the red ID cards. How come they weren't included?
Yeah, so the system was devised on the basis of population. So the letters in the population that were chosen for particular days weren't chosen just by accident. We actually had a look at the entire population of Barbados, adult population of Barbados, with those surnames, and organized and structured it accordingly. If we had moved down to 65 or 60 even, the proportion of persons in that age group would have been far larger than we would have been comfortable with. Generally speaking, each of the 5 subgroups of persons represent approximately 45 to 50,000 persons, pushing, including persons with disabilities as well as persons 60 or 65 and over, would have meant a much larger proportion of population than we would have wanted.
Mm-hmm. Okay, now what exactly is policing of this system going to look like? Yes, people are going to go through the last names on the IDs and look at ages, etc. But is it going to be a situation where a supermarket security guard will be tasked with doing that? What exactly is the policing going to look like?
So we have had discussions all along with the retailers and the banking sector in terms of rolling out this, and it may differ slightly from one establishment to another depending upon the staff complement and what the resources that the particular establishment has in place. But there will be the requirement to present your photo ID before entry. We expect that will most likely be manned by security guards at the larger supermarkets and larger business places. And persons will, perhaps at mini-marts and shops, will be required to then show their ID before they gain entry to the store, even if it is someone who is just serving as a dispatcher, as we used to say in the old days in the traditional shops. I hesitate to use the term policing because we are really asking persons to self-police in the sense that only turn up to the shop or to the supermarket or the market if your surname begins with that letter for the day that you are designated. Only show up on the day when elderly persons are permitted to enter if you are yourself 70 years and over or a person with a disability. And in all respects, since we've started the response, we've been asking persons to basically to observe the level of discipline and care and compassion for one another that would get us through the disease and get us through the epidemic.
Another question that has been sent in, people have been calling and asking us, if my last name is double-barreled, which day do I go?
Yeah, so we don't expect somebody with a double barrel or even triple barrel surname to get 2 or 3 bites at the cherry, so to speak. Each surname will have 2 days allocated to that person. So, for example, if your surname is C, you will have Wednesday and Saturday as the days that are available to you. And so if your surname is double barrel, we would suggest that you use the first part of that double barrel surname. So if your surname is, let's say, Clark McConney, we would expect you to shop on those days designated for persons with a surname of C.
Okay. Dr. Best, let me ask you this. As people are going to be outside and we've been encouraging them to wear face masks, more people are now making face masks for Barbadians to wear. Do you have any words of advice? Is there anything you can tell the people who are making the masks in terms of what specifications they should be and what should people buying them be looking out for?
Sure. So thank you for a great question. What I would start off by saying is that the Emergency Operations Center of the Ministry of Health and Wellness put forward a policy position on the use of face masks by the general public We want to stress that we support the use of face masks by the general public, and by face masks I'm talking about fabric or cloth facial coverings. We're not talking about the use of medical masks. We have to stress that the use of medical masks, such as the N95 mask and surgical masks, must be reserved for the healthcare setting. And you have to appreciate that with this global pandemic, there's a shortage of such masks. And there's no evidence to suggest that the wearing of such masks is of any benefit to the general public. So I also want to take the opportunity to stress that we want people to not become complacent when wearing masks. You still have to remember the importance of hand hygiene, good hand hygiene. So you're washing your hands with soap and water, and you're using alcohol-based hand sanitizer, and also physical distancing. Those measures, in addition to masks, is what we are promoting at the Ministry of Health and Wellness for the prevention and control of COVID. You specifically asked about the making of such masks. There are many different websites that offer guidelines on the making of masks. There's some variation. The Ministry of Health supports the CDC guidelines. So if you go to the United States Centers for Disease Control and Prevention, you will find directions as to how to make cloth masks or fabric face coverings.
Right. Let me ask you this now. I might be for the czar, but I'll put it there, and whomever it is for can answer. We've had 73 cases to date, 5 deaths. It's all been just under a month since we got our first 2 cases of COVID-19. Can you assess for us the progress of the virus so far?
So in terms of the predicted trends and the trajectory, what we're realizing is that we haven't had an exponential growth in the rate of COVID-19 in Barbados so far. We want to keep it that way. We're going to keep it that way by people doing what they're supposed to be doing in terms of physical distancing, in terms of understanding the recommendations, the guidelines, and the policies of the government where the lockdown is concerned. Everything that Mr. Carter has been talking about on an almost daily basis. In terms of the trends in the deaths, I mean, one death is one death too many. Let me start off by saying that. The trends are not far off from what we would have expected, but we have to continue the measures that we've put in place in order to prevent an exponential growth and overwhelming our healthcare system in Barbados.
All right. Mr. Carter, is your assessment similar to or different to what Dr. Best said?
Yes, a similar assessment, because we have had, as I've said before, a large proportion of our population that is elderly, larger than many other countries of a similar state of development. We do also have significant levels of comorbidities in our population, a number of underlying cases of cancer, hypertension, diabetes, and so on. And we know from all of the evidence that has been marshaled that these things predispose persons to adverse outcomes and to greater challenges with managing COVID-19. So it is not by accident that most of the cases that we've had that have unfortunately died are persons who are elderly and or relatively old, and persons who do have some of those comorbidities. I think almost all of the 5 cases did have some underlying comorbidity associated, which makes it very difficult. Persons have also been presenting quite late, and that also represents a major challenge in terms of trying to save life. And that is one of the reasons why we've been very protective in terms of the programs that we've put in place of the elderly population, trying to ensure that we keep COVID-19 out of elderly care facilities, trying to ensure that we keep elderly persons off the road as much as possible, and have specially designated days for them to go out and do their shopping if they must, but appealing really to their relatives and younger family members to go out and do the shopping or go out and do the business on behalf of their elderly relatives.
Mm-hmm. All right, let me ask this question now. It's 2 parts. Both of you can answer. What is the most encouraging thing that you've seen so far on the part of Barbadians in this whole situation? So what's the most encouraging thing, and what's the most worrying thing that you've seen so far in the whole situation?
Perhaps I can go first and leave Dr. Best to speak from a public health point of view. I think the most encouraging thing I have seen is a general acceptance of the restrictions that have been put in place by the majority of the population. That is important because by far the majority of persons have been standing in line in relation to the requirements and the restrictions that we've had to put in place. In terms of the most worrying thing, I guess it would be the obverse of what I said just now. We are still seeing too many people. So even though we are seeing lots of people sticking by the regulations, we're still seeing too many people flouting them, and we're still seeing too many persons who are on the road without the apparent reason to be on the road. We must remind people that we are in a 24-hour curfew, and that 24-hour curfew continues tomorrow and for the next 3.5 weeks, even though we've lifted some of the restrictions. So persons should really only be leaving home if they're going to a medical appointment to see the doctor or to seek medical treatment or dental treatment, if they're going to buy medicine, or if they're going to get gasoline or top up their cell phones, or if they are one of the essential workers. These are the categories of persons who should be on the road. And that is further restricted by a requirement now to be only on the road on the days when your surname would be designated.
Dr. Best?
Well, there isn't a whole lot I could add. What I would like to support Mr. Carter's perspective that there's been generally very good compliance in terms of the physical distancing. People have been staying home. We appreciate that it is rough. It's not easy to stay home, but this is for a time, and we have to continue it because this works. This is going to reduce the spread of the virus. So I just want to encourage all persons watching tonight, all persons listening, to continue the physical distancing. In addition to other measures we've been promoting, such as good hand hygiene, and of course we would have talked about the use of masks by the general public, a position that the Ministry of Health and Wellness also supports. In terms of what's worrying, same as Mr. Carter, there is some complacency amongst persons. You are seeing persons who are unnecessarily close and not practicing social distancing. And there seems to be, amongst those persons and some other persons, a lack of understanding of what it is that the government is trying to achieve. So we encourage people to pay attention to what it is that we're trying to do, understand the reasons why, and adhere. This is this requires a whole of society approach.
Right.
Not just the government, not just one section of society, a whole of society approach, a whole of Barbados approach.
Right, I take that, but let me just say, with one person only so far, to my knowledge, correct me if I'm wrong, having been charged so far for breaching the curfew amid your pleas for people to stay inside, should there be stricter enforcement of that curfew order then? Or rather, why is it?
I would say yes. No, I would definitely say yes. I myself have been stopped and challenged twice by police officers in terms of being on the road, and I had my past to present as a legitimate reason for being on the road. But I would like to see stronger enforcement. We still have far too many people who are not abiding by the restriction. I took a photograph this evening of a kite flying above my house. Now that is breaching regulations twice. First of all, I live near the airport, and it is in an area where persons should not be flying kites. And basically, nobody should be flying a kite in terms of the restrictions that we are seeing. Similarly, I've seen people around doing shopping outside of the hours when you were supposed to shop, or outside of the designated areas that persons were supposed to shop. Lots of people riding around on motorcycles and revving up and doing all kinds of things. None of these could legitimately claim to be observing the basic 4 reasons why people should be on the road. And I would like to see a greater level of scrutiny and application of the law, because it is the law that requires people to be off the road.
Mm-hmm. All right, one last question from me before I invite you to wrap up. Now, somebody sent in this. You can correct it where necessary. There were reports of deaths in Europe among elderly people, and one source was said to be the caregivers. Now, the person who sent in the question said they've seen caregivers in Barbados on the roads in their uniforms, and they're wondering whether what is the situation with the caregivers? What instructions have they been given? What is being done to ensure that they are safe as well when they go to administer care to this most vulnerable part of the population?
So what I can say from a health perspective, we get this question pretty often in terms of people wearing clothes, their uniforms on the road, and then coming into their healthcare facility or the homes of persons. It is not necessary to, all right, let me put this another way. There's no evidence to suggest that that practice is contributing to the spread of COVID, or in fact, other viral infections or other microbial infections. There's no evidence to support that. What we do know from an infection prevention and control perspective is that such persons must adhere to standard precautions that we recommend, standard infection prevention and control measures such as good hand hygiene, the use of hand sanitizer when you can't use soap and water, for instance, the use of personal protective equipment when indicated in the healthcare setting. And that's the healthcare setting. You're talking about care providers. Mm-hmm. So there are also social care providers or persons who do not fall under the direct purview of the Ministry of Health. I don't know if Mr. Carter wants to make any mention of some of the work that's being done with people's empowerment and elder affairs.
Yes, and just by way of wrapping up, Lisa, we are obviously doing quite a bit to reach out to that particular group, in terms of ensuring that persons who are carers have the necessary passes to be on the road. I have spoken about the fact that even that has been abused in terms of persons requesting multiple passes to just take care of one elderly person. But we've been sympathetic in trying to ensure that persons who are caring and looking after the elderly do have the passes to do so. And we've been also reaching out in terms of trying to ensure that we make interventions in relation to that elderly population. So if you just allow me one moment in terms of concluding comments. Tomorrow, Wednesday, is the beginning of this new regime. If your surname is not C to F in the morning or S to Z or Z in the afternoon, stay at home.
Thank you very much, Richard Carter. Go ahead, Dr. Best. Sorry,
if I may, Lisa. I just wanted to return to the somber note that I started on and once again express my sincere condolences to the family and the relatives of the 52-year-old gentleman who would have passed away earlier today. But I also want to extend my appreciation to the healthcare workers working not only at the isolation facilities, but at the quarantine facilities. Without them, this COVID-19 response that we have put forward will crumble. So we really have to extend gratitude and appreciation for all of those workers on the front line.
Thank you very much, Dr. Anton Best, the Acting Chief Medical Officer, and COVID-19 Czar Richard Carter. Thank you so much for sharing this time with us this evening, gentlemen.
You're welcome.
Thank you.
And just to let you know that the Czar Richard Carter will be on the radio calling program on CBC's 100.7 FM tomorrow from 9 a.m. to answer some questions, any questions that you may have on the new guidelines for COVID-19 and more. Well, too many Barbadians are still engaging in indiscriminate burning despite the introduction of a new permit to burn fee. That's according to Minister of Home Affairs Edmund Hinkson. The Fire Service Fees Order 2020 came into effect from April 1st. It states that any person who wishes to use an open flame outside his or her home is required to purchase a burn permit from the Barbados Fire Service at a cost of $150. Minister Hinkson says this is a reasonable legal requirement since the fire service will have knowledge of and can supervise and assist with the burning to ensure the flame does not get out of control.
It is clear, however, from many reports reaching the various authorities that many persons are ignoring the new law. In fact, indiscriminate burning has apparently increased since the institution of the curfew, with more people being at home and perhaps clearing their homes of what they no longer need. This practice has to stop. It is a breach of the law to do so.
Minister Hinkson contends the practice is insensitive and uncaring to people in the neighborhood, many of whom suffer from asthma, sinus ailments and other respiratory problems. He says this of particular concern at this time since some of the affected people will be susceptible to catching COVID-19 as a result of their pre-existing conditions.
I'm therefore appealing to all persons to be considerate and to give a thought for those who reside in their vicinity, and to desist from this practice, from burning rubbish indiscriminately in their yard or anywhere else. Alternative means to get rid of what you no longer require are available and ought to be utilized. My ministry will have no choice but to propose to the Cabinet a platform for the enforcement of civil penalties against perpetrators if this unacceptable practice continues.
Barbadians are being encouraged to wear cloth face masks for added protection while on the road. In tonight's edition of Coping with COVID-19, Shane Jones highlights just how to use those masks.
While the wearing of cloth masks in public settings has been given the green light, it is important to note that the use of masks alone will not completely protect you from contracting COVID-19. You must still maintain 6 feet physical distance from others, as well as washing your hands regularly and keeping them out of your face. Cloth masks become less effective over time and should be changed after every 2 hours of use. When changing out masks, wash or sanitize your hands before touching the new clean one. Cloth masks should not be placed on children under 2 years old or anyone who has trouble breathing or is unconscious. Even if you do not feel ill, you should still wear a mask in public as you may be carrying the COVID-19 virus but not displaying symptoms. The fact is that you may be infected right now and don't know it. The correct way to clean your cloth mask is to wash it in a utensil with soapy water for 30 minutes, keeping the water at 70 degrees Celsius or higher. That will deactivate any virus or bacteria. Store in a dry, resealable plastic bag when dry. So here's how to correctly wear a standard cloth face mask. Wash or sanitize your hands first. Hold the mask by the ear loops. Bring the mask to the nose level and place a loop around both ears. Ensure the mask covers your nose, then pull the mask over your mouth and chin. Make sure you can breathe through the mask and wear it whenever going out in public. Now, when removing, avoid touching the front of the mask, which is contaminated. Only touch the ear loops. Do not purchase surgical masks or N95 respirators. They are categorized as critical supplies and must only be used in healthcare settings. My cloth mask protects you, and your cloth mask protects me. These are some tips to help you cope with COVID-19.
New shopping and banking measures will go into effect from tomorrow. Lisa Lord explains the days and things you need to know before you hit the road.
We start with senior citizens aged 70 and over and members of the disabled community. There are 2 specially designated days for them to go shopping at supermarkets, hardware stores and fish markets, irrespective of their surnames. The days set aside for these vulnerable groups starting Sunday, April 19th, are Sundays between 9 and 11 a.m. and Tuesdays between 8 and 11 a.m. Tuesday is also the day designated for these groups to conduct business at banks and credit unions between 9 a.m. and 1 p.m. They are reminded to travel with their national identification cards, driver's license or passport, as they will be asked to show picture ID before entering the premises. They are also advised to bring a shopping list of essential items so they can shop speedily and to carry an umbrella and drinking water in case there is a period of waiting before they are allowed entry. People whose surnames begin with the letter A or B, your shopping days will be on Mondays between 8 and 11 a.m. and then again on Friday between 1 and 4 p.m. Your banking day will be Monday between 9 a.m. and 1 p.m. People whose surnames begin with a C, D, E, or F, your shopping days will be Wednesdays between 8 and 11 a.m. and Saturdays between 1 and 4 p.m. Your banking day will be Wednesday between 9 a.m. and 1 p.m. Surnames starting with G, H, I, J, or K, your shopping days will be Thursdays between 8 and 11 a.m. and Mondays between 1 and 4 p.m. Your banking day will be Thursdays between 9 a.m. and 1 p.m. Those whose surnames begin with L, M, N, O, P, Q, or R, your shopping days will be Fridays between 8 and 11 a.m. and on Tuesdays between 1 and 4 p.m. Your banking day will be Friday between 9 and 1 p.m. And people with the surnames that begin with S, T, U, V, W, X, Y, or Z, your shopping days will be Saturdays between the hours of 8 and 11 a.m. and Wednesdays between 1 and 4 p.m. Your banking day will be Wednesdays between 1 and 4 p.m. 2 special days have also been set aside for healthcare and other essential workers, Thursdays between 1 and 4 p.m. and Sundays between 11 a.m. and 2 p.m. Banking days for these workers will be Thursday between 1 and 4 p.m. As it relates to all shoppers, you will be required to observe a physical distance of a minimum of 6 feet. Anyone feeling ill is advised not to go out. It is also advisable to wear a cloth face mask. The number of people allowed in each store at one time will be 75 for mega supermarkets, 50 in the large, and 25 in the smaller stores. Lisa Lord, CBC News.
Thanks, Lisa. Well, the contribution of frontline workers assisting in the fight against COVID-19 in Barbados is being recognized and celebrated tomorrow. And Barbadians are invited to take part in CLAP Barbados. Similar initiatives have taken place across the globe. Founder Sally Clark says the initiative was started to show healthcare workers we care. She says Barbadians can take part from their homes every Wednesday night. Ms. Clark was a guest on CBC TV 8's Morning Barbados.
The CLAP Barbados, we're going to be doing a clap every Wednesday at 8 p.m. and I'm asking all Barbadians to come out at 8 p.m. On a Wednesday and give their support and give their recognition to all the frontline workers and all the essential workers.
Yes, and that starts tomorrow evening, yes?
Tomorrow evening at 8 p.m.
Well, the initiative has been welcomed by Nursing Administrator at the Queen Elizabeth Hospital, Marlo St. Hill.
We are obviously not insulated from this as part of the world and the wider community. So we've had to mount a response at the Queen Elizabeth Hospital to ensure that we are taking care of the patients in the safest possible way, not only for the regular care, but we've now got to take on the challenge of COVID as a worldwide and international pandemic. So we've had to ramp up our responses in terms of securing the types of personal protective equipment that we will be requiring so that our healthcare workers remain safe.
And here is a tip now from Cooperators General Insurance.
This tip of the day is brought to you by Cooperators General Insurance Company Limited. Insurance the way you want it to be.
COVID-19 is spread through respiratory droplets when an infected person coughs, sneezes, or speaks. People can also be infected by touching a contaminated surface and then their eyes, mouth, or nose. Cooperators General Insurance, encouraging you to stay home and stay safe.
Guyana is looking towards India and China for financial assistance in its national fight against COVID-19. We'll hear more in this NCN News report.
This was confirmed by head of the National COVID-19 Task Force, Prime Minister Moses Nakamoto. In addition, Guyana will see some 30,000 protective masks coming from China as part of a donation.
I can say this, though, that Guyana has not been deemed disqualified from receiving any assistance from anywhere. We are pursuing assistance from India by way of the Indian grant to Caribbean countries of $14 million US. We are making approaches for them to, it's a low-hanging fruit, as it were, to utilize Guyana's allocation for supplies relevant to the COVID-19.
Mr. Nakamoto also revealed that the Finance Ministry is looking to tap into assistance from the World Bank for $5 million US.